51-year-old Kathy McCullough is reaching new heights. Rock climbing is just one of many challenges she's conquered in her very active life.
To be able to move and do what I want to do, that's really living to me.
Life for her also includes running 14 marathons, skydiving, rafting.
This was a bike trip in Vermont.
And biking. But about 3 years ago, she was forced to give it all up.
There's a little bit of depression kind of almost that goes with the fact that, I think all people have to adjust as they age.
Like many baby boomers, Kathy has osteoarthritis. Her doctor, Dr. Richard Rothman, founder of the Rothman Institute at Jefferson, said she needed a bilateral hip replacement. It's a procedure becoming more and more common. In fact, from just 2000 to 2004, the number of hip replacements jumped nearly 54%. Knee replacements went up by almost 60%. Dr. Rothman invited Action News into his OR to see the procedure and how it's gotten better. Rothman says in the past they would tell patients to wait until they're practically immobile before getting surgery. Now that's changed because the implants today last longer and the recovery is quicker due to better pain medicine, specifically a drug called Depador.
It's just one shot and the medicine stays there and gives you almost complete pain relief for 3 days.
For Kathy, she was up and walking the night of surgery. Though she didn't have any pain, she admits there were pitfalls. She got sick from the medication. But Kathy says overall, her recovery went smoothly. She's part of a growing trend of patients to have both hips done at the same time.
I didn't want to have to go back, and do it a second time. I want it to be once and done.
Rothman says if patients are young and healthy, doing both sides is just as safe as doing one at a time. And despite having a major operation, he says patients in the end will be healthier because they'll get their lives back.
Exercise is the fountain of youth.
That's something this baby boomer has known from the start. Kathy is now 7 months recovered.
I don't know if I'll be 100% as though it never happened, but I think I'll be close to that.
And risks of joint replacement surgery include a 1% risk for infection or a blood clot, and 1 in every 1,000 patients dies. Now, experts say surgery is still a last resort in most cases. Jim, as a side note, these procedures are becoming so popular that surgeons say there won't be enough of them in the future to keep up with the demand.
Or enough hips and knees.
Well, I guess they'll keep making them.
If they can make the money,
if they can make the money, they'll keep making the implants.
Thank you, Alec.